guys, it's Makeup by Seppi. So this is the question and answer I promised you guys for the nose job that I did. I had many of you guys ask me so many questions about who I went to, how much did it cost, what did I have to go through to do it. First of all, I want to give you guys a little background story with why I decided to get mine done or what happened to me. I broke my nose 3 times when I was little. The first time was when I was like about a year old. I fell from my tricycle face first, broke it once then. The second time I was going up like a bunch of crawling up. I don't remember what it was, but I fell down and I broke my nose this way, so it kind of pushed it that way. The third time I was running down the hill and my foot got stuck on the rock, and the last thing I remember is feeling like I'm going down the hill with my nose. Then I wake up and like my eyes are like down back here because it was broken really bad. So like literally for as long as I can remember, I've had this nose since I've had a broken nose since I can remember. And it was difficult growing up, dealing with the fact that you felt like a part of your face didn't really match you, didn't really fit in with everything else. Also, at the same time, I didn't want my nose to look so different after I got a nose job. I told which is why it took me 8 years to find the right and the perfect doctor. My doctor's name was Dr. Kotler. He's located in Beverly Hills. Robert Kotler. I knew 2 different people who went to him, and I actually liked the way their noses turned out because it looked really natural. Like I didn't even know they got a nose job, and I can usually tell when they got a nose job. My little Axe spray, awesome. Let's move that. Anyways, and I really like that. Theirs was really natural looking. You couldn't really tell they got a nose job. You didn't see this whole fake nose slope thing or like just the whole face changing. Mine looks really different now because I'm extremely swollen. Keep in mind I got my nose done less than 10 days ago, so his work is actually pretty good for, this is actually really good for this only being done 10 days ago. The procedure for me, because it was 2 procedures in one, it was correcting the brokenness and also cosmetic as well, because once you're correcting it, you also have to make sure it looks right. So my procedure cost us $12,000. It is a lot of money, but it was something that my family and I were saving up for many years, because it was something that everybody knew I wanted. Everybody knew that I needed to do. My family knew I needed to do this as well, and they were actually very supportive. Another thing I wanted to add about the pricing, actually, it's different for every single person. Mine ended up at that price. It would started higher, obviously, but they do work with you. Everyone's nose prices would be different. Mine, we were able to bring it down a little bit, because my schedule was flexible. It was right after my finals, and I had told them, you guys can pick whatever day works for you, and they worked with me with the pricing. But so yeah, they do work with you with the pricing. And the thing is, this doctor, their staff, everything is worth the pricing. A lot of doctors, I went to a lot of different consultations, and this one, even though it was pricier than most, it made me feel the most comfortable. It made me feel like, okay, you're the one I want to go with, because it was, you felt like this is the nose I want. They talked about everything, so that really made me feel special, and I was like, I'm going to do this, So we talked about the pricing, and everyone's, like I said, is different, but that was the price for me. I went online on Dr. Kotler's website, and a little chat popped up. And I talked to somebody there, and I asked them about consultation, how would it go? And immediately someone named Dola from the office, she's one of the sweetest people you'll ever meet, gave me a call, and she scheduled a consultation for me. we went into the consultation and they took photos of me, you know, look sideways, looking straight, smiling, not smiling. And right there, they photoshopped it and they told me, this is how we're gonna fix your nose and this is what's gonna look like. And it was perfect, you know, it didn't look that different. It didn't look like we made such a major change on my face. I still looked like I'm me. I didn't look like I totally changed or anything like that, and I was really, really happy with it. And we scheduled my appointment with my surgery for, first it was supposed to be Thursday, April 19th, but then my doctor got the flu and we had to push it back to Monday, March 23rd. So from March 19th to 23rd, there were many, like, not many, but like a couple of things that I had to do before surgery. Sorry, making sure I don't get a pimple around the nose, because that's a sign of bacteria. They don't want to open up your nose if they think there's like infection or anything. They asked me to put ointment in my nose to make sure, again, no infections or anything. I wasn't supposed to eat before after 11 p.m. the night before surgery. Of course, I had to do blood tests and had to get a physical done to make sure, you know, I can go ahead and do the surgery. The day of surgery, we were supposed to be in the surgery center at 7 a.m. We got there at 7 a.m. and filled out a couple of papers. They gave me a Valium to take, a pill to calm me down. And then, you know, they put the little needle thing in my arm, which I hate needles, but didn't hurt. The last thing I remember, honestly, to be honest with you, is they took me into the surgery room. I was laying down and the doctor who puts me to sleep said, "This is the fun part." And I said, "Oh yeah, you know, really fun." And I woke up with the cast on my nose. I woke up with no pain besides a headache, but I always get a headache, but that has nothing to do with the surgery. I woke up with no pain. I could breathe because my doctor has invented nasal airways. They're called Kotler nasal airways, which are these tubes that he inserts into your nose that pretty much go through your airway and you can breathe, which is the biggest deal, because every single person I spoke to before I got a surgery done said that the number one thing that made them not want to do it was the fact that they're scared they can't breathe afterwards. And people who did do it said that they couldn't breathe, and that was a big deal for them. And that was so difficult, they couldn't breathe, they woke up throwing up and all that stuff. Me, none of that happened for me. I just woke up. I did lose my voice, and not that I lost it, I just couldn't talk. And that was because my tonsils, they've never been removed. I have large tonsils, and they were being sensitive because of the anesthesia that they put in and the tubes. They were just being a little bit sensitive, so I couldn't really talk. But other than that, everything was fine. Dr. Kotler called me the night of surgery to make sure I'm okay. After surgery, Dr. Kotler and their assistants gave me this little bag that had everything I would need to clean up my nose, any sprays that I wanted to spray into my nose, anything like that. They put it in a bag. They even put Q-tips in a bag, like everything. That as if I were alone and I couldn't go to the pharmacy, I would have everything I needed. Which I really appreciate that, because, you know, my mom was there for me, and my whole family was, obviously, but, you know, she gets tired and I didn't want her to go back and forth with everything, and I had everything there for me, which was a big deal. So if you guys, so the surgery cost $12,000. Also, I'm forgetting the questions. Let me look up the questions. The location of him, I'm not sure. You would have to Google it. But his name is Dr. Robert Kotler, like R-O-B-E-R-T, and then K-O-T-L-E-R, Robert Kotler. and it's in Beverly Hills. It's on Bedford Drive, actually, Bedford and Santa Monica. And it's a really nice building. So yeah, the healing process is supposed to be a good 3 weeks for all the the super swollenness to go down, and then another 6 to a year for the rest of it. He does offer fillers after your surgery, after your nose swollenness has gone down, in case it's not completely straight, or in case there's something that's bugging you about it. He can go ahead and fix that for you free of charge with the fillers. I don't think I would be doing that because I don't want my nose to be perfect. That was my thing when I went in there. I told him I do not want my nose to look like it's the most perfect nose, because to me that's fake. I want a nose that's been fixed, but it's not perfect, because my nose was not perfect. But I don't want to look really fake with it. And I've been getting a lot of compliments, even though I'm still swollen. I go out and it's boosted my confidence. I go out and I get random compliments, and I'm like, I can't wait for the swollenness to go down. I mean, because I'm already getting compliments, and this isn't even the finished, the complete look. He also, there's a muscle underneath here that makes your nose come down when you smile, which was also what was happening with me. It was overactive. So he went ahead and cut that for me too, which is why I'm really swollen right here, which is why it looks like I have lip injections. Promise, I swear to God, I did not get lip injections. I am not for all that stuff. Just wanted to get this nose fixed. So yeah, I hope this answered everything for you guys. So I talked about the price, I talked about the procedure, I talked about if it hurt. It didn't hurt at all. The pain medication he gave me, I probably took a total of 5 of them, and that's it. Like I said, no pain. I mean, yeah, if you touch your nose, it hurts, but if you're just standing there not doing anything, it does not hurt. So you don't need to worry about pain or anything. You do need to clean it after, every once in a while, because mine has a lot of stitches inside of it. So I need to spray it with, the moisturizing sprays, and I also need to put ointment in it to make sure it's moisturized. Otherwise it feels really dry, and it feels like, it just feels like I can't move my face almost. But other than that, everything's been amazing. I will, if you guys I will also do another video in the next month for an updated version of this, so you guys can see how it looks with the swelling having gone down a little bit more. Let me know below if you guys have any other questions about this procedure. Again, please let me know, comment below. We can go ahead and have a little chat on the comment sections. And please like and subscribe. I love you guys, and thank you for your constant support.